Good morning, everyone. I'm pleased to present these data on behalf of my colleagues who've participated in the serious phase 2 study titled the phase 2 study of Daratumumab in patients with more than 3 prior lines of therapy or double refractory multiple myeloma. Multiple myeloma remains an incurable disease, and patients who relapse after treatment with proteasome inhibitors and or immunomodulatory drugs such as lenalidomide or thalidomide have a very poor prognosis and very few options. CD38 is highly expressed on myeloma cells and is a promising therapeutic agent. Daratumumab is a human monoclonal antibody that binds to the CD38 expressing cancer cells and induces cell death through multiple mechanisms. This particular study was an open-label international multi-center study. The eligibility included patients who have received more than 3 prior lines of therapy, including a proteasome inhibitor or an IMiD, or they were refractory to their most recent IMiD or proteasome inhibitor therapy. Initially, the patients were randomized to 2 dosing schedules, 8 milligrams per kilogram, and 18 patients were treated on that arm, and 16 milligram per kilogram, where 16 patients were dosed. 16 milligram per kilogram dose was found to be more efficacious, and a further 90 patients were enrolled on the 16 milligram per kilogram dosing schedule, with the primary endpoint being overall response rate. The overall response rate was 29%, and it was consistent among various subgroups. Patients were heavily pretreated, median of 5 prior lines of therapy. Median duration of response was 7.4 months, with some very deep responses observed, such as stringent CR rates. The 1-year overall survival rate was 65%. In terms of safety, the 16 milligram per kilogram DARA dose was well tolerated. No patients discontinued therapy due to DARA-related adverse events. Infusion reaction rates were generally occurring during the first or the second infusion and were grade 1 or 2 and were managed with standard of care therapy. In conclusion, Daratumumab monotherapy produced unprecedented overall responses that deepened over time in this heavily pretreated multiple myeloma patient population. These results highlight the potential of Daratumumab as a novel, well-tolerated single-agent therapy in various stages of myeloma treatment. These data support further studies of Daratumumab in combination with current available and approved therapies. Thank you.